Hello, my name is Silvia Mendoza. I'm a patient navigator. Um, so, my job is to help you navigate the healthcare system outside of what your doctors can provide in their normal care for you. So, if you're in need of things like assistance in transportation, childcare, even just setting up your next appointments, that's what I'm here for. I'm also here to help you understand your health a little bit better, kind of like talk between the two of us. So, the problem we're identifying today that we want to address is your tobacco use and dependency. Um, I want to start by providing you enough information just to make a little bit of an informed decision. So, tobacco use is the single largest preventable cause of death, disease, and disability in the US and worldwide. So, if you find yourself interested in quitting, you're not alone. About more than 50% of people who smoke or use tobacco want to quit. Approximately 1 in 6 adults 18 years or older smoke cigarettes and electronic cigarettes. These nice little vapes are on the way up. And tobacco use disorder includes 11 symptoms. These might be symptoms that you're experiencing yourself, and they're broken down in mild, moderate, and severe. So let me know if you're experiencing any of these. So some of the withdrawal symptoms would include depressed mood, insomnia, irritability, frustration, anger, anxiety, difficulty concentrating, restlessness, increased appetite. So have you been experiencing any of those? And are there any resources you would like to have available to you? So, little information about tobacco. It only takes nicotine 7 to 10 seconds to actually hit your brain, and then it hits your brain and provides a nice little dopamine rush. It makes you happy, nice, calm, relaxed, reduces that irritability, and then it goes away, and you start getting cravings again, which is why you hit it so often, depending on what you're doing. So, my question is, are you willing to make an attempt to quit your tobacco use? So, now talking about solutions for you, there are different forms of solutions that are accessible to you. One of those are pharmacology. The whole point of this is to motivate you into like understanding that there are possibilities for you to quit. And therefore, some of these are FDA approved. There's medications that you have to get a prescription for. There's gum, inhalers, nasal sprays, and nicotine patches. And they all have different anticipated quit days. So if you intend on quitting sooner, you might want to go for something more like a gum or a patch. Those typically take between 1 and 2 weeks. But if you're not ready to quit just yet, there are longer options for you. So, amongst these other solutions, there are nicotine related ones and non-nicotine related ones. So you can also choose whether or not you want to like reduce the amount of nicotine you want in your body, which would be relating to the patch. That's why it takes longer. So over a 24-hour period, it releases into your body, which helps you like with your cravings and such, and then eventually you would stop using it. So I don't know if any of these are interesting to you. And then a question I would have for you is, what does your social support look like? Your support system is very important, especially in quitting. It's probably one of the highest factors in whether someone quits or not. So if you have anyone who's also informing you that maybe this is a better decision for your life, those are things that would help you rather than someone who continues to smoke around you and such and doesn't support this. And then another thing I would like to talk about as a patient navigator is what your insurance coverage looks like, because not everyone's coverage looks the same, and I'm able to look for resources for you in order for you to be able to afford the cost of whether it's the medications you want to look for, patches, I can get you in contact with someone. And then I also want to make follow-ups relating to this tobacco dependency, see how you're doing in a couple of weeks. I also can give you a number relating to quitting. It's 1-800 something quit. I would have to find out. I can let you know. But yeah, do you have any questions relating to this dependency? Okay. Hi. That was a little awkward, but not too bad. Okay. So, did I represent myself professionally in the role of a patient navigator? I believe I did. I know that they're primarily supposed to make the conversation comfortable. It's supposed to be one on one, but to a respectful patient, like worker level. And I think I was able to do that. Ask a couple questions like in between and make sure that like this was something that the patient wanted to go through with. Did I successfully make the case that changes needed possible? I believe I did. I talked about social support. I also talked about how like the disorder may make you feel, especially like in the intensities with the mild, moderate, and severe, different types of symptoms that come from withdrawal. Like just allowing someone to make an informed decision. Also, if more than half people want to quit who are still smoking cigarettes or e-cigarettes or using patches or chewing tobacco, I feel like informing someone that they're not alone is a big key in that. Did I sufficiently explain the cause of the problem? The cause of tobacco dependency, I did mention how it like connects to the brain, hits the brain in 7 to 10 seconds, and then once the receptors are done, like a craving comes back again. So I guess to an extent I did explain like the scientific reasons behind it. Did I discuss phyto impact factors adequately? I'm not entirely sure. As far as that one, I had a little difficulty understanding. I just wanted to mention the frequency and people who use, so at least 1 in 6 adults. Intensity, I referred to many of the symptoms. Duration, I referred to the amount of time nicotine lasts. And then onset, I had a little difficulty writing about. Was my solution practical, likely to be adapted by the proposed stakeholder? I believe it could be. The word medication is kind of scary, especially when you say like pharmacology, but I think options like inhalers, nasal sprays, like patches, I don't feel like those are so frightening for a patient, and giving them those options is something that would allow someone to feel like, okay, I could do this. Like this is likely. And also the fact that I mentioned the time frames, like being able to anticipate in your head, like, okay, I have this much time before like I have to make a change in my life officially. Like you work towards it, but for you to like actually, I guess, like adopt that and set that as your goal is very important. And then what did I do best? What can I do better in the future? Best, I think, would have been talking a little freely, more like I'm talking to someone. As far as what I can do better in the future, maybe find a way to break down like solutions in an easier way to understand. Maybe more of how like a patient can get in contact with someone rather than saying like I can get you in contact with someone, because that is a part of my job as a patient navigator. And okay, thank you.